Choosing the intraocular lens for cataract surgery can be one of the most difficult choices of the surgery. The natural lens, when we are young, is very functional, both in that it is clear to focus the light, and in patients who are under about 40 to 50 years old, the lens changes shape to be thinner to focus far light and becomes thicker to focus light up close. The lens needs to be different strengths to focus light from far away, like the images we see when we are driving, versus light that is close up requires more power to focus, and so the lens has to change shape to focus that light sharply as well. And as I say, when we're young, under age 50 for most patients, our lens is able to naturally do this, and patients don't need any glasses if they have good distance vision. Some patients need glasses to correct their vision for good distance, but don't need a bifocal segment at this age. For most patients, once they enter their 40s to 50s, they start to notice that reading vision becomes more difficult, and they have to either buy reading glasses or wear a bifocal segment because the lens loses its ability to change shape and becomes fixed in a certain configuration. One of the difficulties of choosing a plastic lens during cataract surgery that we put in the eye to replace the natural lens is that none of the plastic lenses that are available do a very good job of changing shape the way that a young natural lens would. This means that the lens can be focused well for a distance target or be focused well for a near target, but can't change shape to give us perfect vision both at distance and at near. So, there are essentially a variety of options when thinking about the intraocular lens, the plastic lens that is going into the eye. The majority of patients I see have good vision at distance and wear reading glasses for up close, like working on their iPhone, on their computer, reading a menu. They're used to that configuration and they want to keep it with the sharpest distance vision possible, sharpest near vision possible, although needing glasses for that near vision. That's the most common pathway that people choose when they're selecting a lens. Another option is patients who are used to reading without glasses, who are nearsighted and can see their phone and menus and all of that without glasses, and then are used to wearing glasses for driving and seeing at distance. We can keep that same setup and give you good vision at near with prescription glasses to see far away. A third option for patients who otherwise have very healthy eyes with no other ocular disease is a multifocal lens. The multifocal lens splits essentially half of the light from far and half of the light from near, so that both are in focus. But you can imagine that if only half of the light is in focus, then the quality of the image is going to suffer. So, while these patients often achieve 20/20 vision at distance and 20/20 at near, which is an excellent result, they have a little bit less clarity and have reduced function on formal tests of contrast sensitivity. But I would say these patients occasionally complain that things are a little bit less clear, even though they test at 20/20, and have a higher incidence of glare and halos, especially with nighttime driving. So I think this option is a good choice for people who really want to minimize glasses wear and are willing to trade off a little bit of the sharpness to minimize the amount of time that they need glasses. So these are the three basic categories of intraocular lens that can be placed. That is to say, we can place a lens that targets good near vision with glasses for distance. we can place a lens that targets good distance vision with glasses for near, which is the most common selection of patients undergoing cataract surgery. Or we can place a lens that splits the light from distance and near so that both are in focus in order to minimize the amount of time patients need glasses. But there is a trade-off in terms of the quality of vision because only half of the light will be in focus. An additional consideration for a minority of patients is correction of astigmatism. In a healthy cornea, the cornea is shaped spherically so that light is equally focused, whether it comes in vertically or comes in horizontally. However, some patients have an irregular cornea that's shaped a little bit more like a football and focuses light differently whether it comes in from a vertical object versus a horizontal object. This means that an object will be a little bit out of focus relative to the things around it if you don't correct for that astigmatism. Typically, this is corrected for with glasses or with contact lenses, but in patients undergoing cataract surgery, we have the option of implanting a toric lens. This lens is created to specially counter the shape of the cornea and has to be aligned in the correct direction so that it balances the shape of the cornea with the shape of the lens and brings everything into focus in a clear point. A toric lens can be used with any of our previous 3 lens selections. That is to say, patients who target good near vision but have astigmatism can benefit from a toric lens for good near vision. Patients who want good distance vision and have astigmatism can also benefit from a toric lens. And patients who choose a multifocal and have significant astigmatism really should have a correction of that astigmatism, and a toric multifocal is my preferred way of correcting that astigmatism. Astigmatism that requires correction is probably only present in about 10 to 20% of my patients, and we can review your biometry and discuss whether a toric lens would be of any benefit in your case. One additional thing to consider beyond the medical implications of which lens you choose and how that will affect whether you need glasses is that only standard lenses are covered by insurance. Standard lenses are lenses that focus the light from one distance and do not correct astigmatism. So patients without astigmatism who want a near or a distance target, that's covered completely by insurance. However, patients who have astigmatism and want that to be corrected with a toric lens, or patients who want a multifocal lens, there is a cash pay element to that. These specialty lenses are considered cosmetic by most insurance providers because the goal of these lenses is to reduce the amount of time that you would need glasses. And insurance providers consider this reduction in glasses necessity to be a cosmetic benefit in addition to the primary benefit of surgery, which is to improve the best vision that is available to you while wearing glasses. If you decide, after our personal discussion of the lens options, that you would like one of these specialty lenses, then my surgery scheduler can discuss with you the various prices of these lenses and payment options that we have available.